This is another case with lack of space in the frontal area on the lower jaw, and my customers asked me if we should extract one of the incisors, but I'll try to make a setup without an extraction. We will expand, we will make some IPR, some significant IPR, and see what we can get. Okay, let's start with checking the axis of the roots. Go to change local origo. And my strategy is gonna be to expand the lower teeth, the upper teeth, and I think I'm not going to distalize. The contacts are fine. I think I'll do something to this second molar on the right side, on the lower arch. But I'm sure we cannot fix this crossbite because it's just not possible without some auxiliary stuff or buttons, elastics, and blah blah blah. Maybe it isn't possible at all because of lack of bone in this area. We'll see. Same on the left side. I'm not sure if we can successfully fix this crossbite. Even if we do, we'll get the immediate relapse, as I can see now, but we'll try. So we'll start with checking the axis of the roots. Since I'm going to just expand, nothing else, I maybe add some rotation. So I follow the anatomy of the teeth and set this mesodistal line parallel to the incisal edge. Now we changed the point of view and checking the angulation of the roots. So since I'm not going to distalize, I put them this way. I set them this way for the premolars and molars. And for the canines and incisors, I follow the actual root anatomy. I also need to make sure that all the rotation center is set in the middle of the root. So for this case, I set 70% and the center rotation in the root. Now let's do the same for the lower jaw. I'm not sure if we can fix these rotations. I'm not even sure that we should do that because rotating these premolars will decrease the room in the dental arch, but we'll see them in the future. Let's firstly set all the axes correctly. so that for the incisors we set this mesial distal line parallel to the incisal edges, so that our movements, our rotations will be correct. And for this teeth, I'll follow its roots because we're going to tip it distally. But for the left side, we're not going to do any tipping, any distal tipping or mesial tipping. We're going to do just some expansion. So that's why I ignore the anatomy of the roots. I just set this mesial distal line perpendicular to the crown's anatomy and parallel to the occlusal plane. But for the frontal teeth, I follow the roots anatomy. The torque is fine. Okay, let's go to the virtual setup module. And I would start with the lower arch. Let's make the bone and the gingiva transparent. I would even remove the gingiva, we don't need it. No. I like these colors more. Well, let's start with some expansion. So here we start to see some gaps and we'll make some distal tipping to close them. Once expanding, I always check if we have enough bone for our plant movements. So I had already moved 2 teeth on each side to the distal direction at the layer 1, so that I cannot move more than 2 teeth on each side distally for one stage, because that way we'll not have enough tension, enough anchorage. That's why we need to divide treatment into a few layers, into a few stages. Okay, let's extract this third molar. And make some distal tipping for the second molar. Now, let's reset the positions of the incisors and start again. Let's do it slowly. We have a big crowding, but I think we are able to solve it. So we start with some expansion, with some distal tipping of the molar, of the premolars and canines. And then we will make the layer 2 and start to move the frontal teeth. Yep. At the layer 2 we distalize the canines. So we keep in mind it will make some IPR here between the canines and first premolars. Then we can distalize and tip the lateral incisors forward at some rotation as well. I'm a big fan of round tripping movements, so that we need to procline first and combine the proclining with some rotations, so that the degree of rotation doesn't exceed the degree of torque, but it can be individually adjusted by looking at the ratio between the crown size and root size. So if we have pretty short roots, it's good news for us because we can go beyond the limits. We can exceed our limits. We can rotate faster, and it's quite useful for this case. But anyway, we have to combine the rotations with the tipping. Otherwise, the rotations will not be complete. I think we should have distalized more on the layer 1. So that we can distalize more at the layer 2. We need to get a lot of space. Fortunately, we're still in the bone. Okay, let's make the third layer and focus on the central incisors. Oh, we see some fenestration of the roots. So we stop at this point. And I guess we'll have to use some buttons, elastics to complete these rotations. So layer 3, layer 4. I used to use only 2 layers for crowding cases. You just expand and you retract. But for this case, I want to be as slow as possible. I want to make sure that we reduce the IPR as much as we can. Okay, layer 3, layer 4. No. Okay. Layer 1, layer 2, layer 3, layer 4. For this case, we have to use the Zendura FLX plastic sheets. We definitely have to use the polyurethane to get the best possible results. Wow. And the final layer is gonna be the fifth one. Now I'll make one more layer for the rotations of the central incisors, because I'm not sure that they will be complete without the elastic chains and buttons, because we don't combine the rotation with the tipping. It almost rotations around the teeth axis, it's almost the bodily rotations, which I personally don't like, and I don't believe they work for a big degree. So I'm going to add an additional layer, or we'll make a refinement. But let's do something to the upper teeth and then finish with the lower. I guess we can make some intrusion. So since we have some expansion on the lower arch, we need to follow the same protocol of expansion on the upper teeth to maintain the contacts. Let's start with the expansion. So we cannot expand the last teeth and the dental arch, so we don't do it. Now let's go to layer 1, the lower arch, and check if our contacts are good or we should do something else. This is the maximal degree of expansion of the proclining of the lower incisors, so we maintain some sagittal gap. Okay, it's good for us, so that we don't have any premature contacts between the teeth. Let's add some more rotations and tipping for the upper premolars. I never set the tight contacts between the posterior teeth. while making the setup, because it just doesn't make any sense. The contacts will be set by the mother nature once we finish the treatment and remove the liners from the patient's mouth. We can create super tight virtual contacts, but it's not gonna be a realistic thing. So here we have some crossbite, which is not gonna be fixed. I forgot to complete the distalizing the molar. Let's set it to this position. Well, the contacts looks pretty fine. And now we can focus on working with the frontal teeth. That was the layer 1, where we made some expansion. And then the layer 2, we will try to set the final positions of the frontal teeth. Now let's see if we can reduce the sagittal gap. It's not our primary goal because we had the sagittal gap at the start. So it's fine if we have some sagittal gap at the final stage. Maybe we can make some distalization to reduce the sagittal gap. Yeah, I think since we make a big case, it's gonna be a pretty long case. So let's do some distalization for the upper teeth. So I never know what strategy I'll choose before I start to make a setup. Okay, let's extract third molar and start with I'll make the tipping movements, not Wadley movements. Let's start with some tipping. We'll make it slowly. I think 3 degrees for each molar is fine for the layer 1. And 3 degrees of tipping for the incisors. That's what we need to do to save time for the future. Now we set the second molars to the final position, about 6 degrees. It's equal to approximately 1 millimeter. expansion, maintaining the width of the dental arch, and some distal tipping. And we expand the frontal teeth, rotate them. We can do these movements simultaneously. Layer 3. We've done with the second molars, and now we set the first molars to the final position. Let's check ourselves. People like the contacts between the... Yep, it's a crossbite here. So if we want to fix the crossbite, you see, it's gonna be bullshit. So if we set the primary goal of expanded the dental arch, we need to use some surgical assisted techniques, which I personally like and broadly use in my practice. Layer 4, step-by-step distalization. So since we are not going to use any bodily movements for distalization, we don't need any class 2 elastics here, since we're fine with the tipping movements. No. It's too much. I forgot to move the incisors. And canines. Let's check the contacts between the upper and lower arches. Now I like them much better than the first attempt when we made just expansion. Well, it's the layer 5, so we start with distalizing the canines. Layer 6. and it's time to set the canines into some proper contacts. The rest is going to be done by some self-adaptation of the dental alveolar system. Some distal tipping of the laterals. And then the layer 7. We are closing the sagittal gap as much as we can. Let's use the combination of bodily movements of retraction and tipping. Let's make some final adjustments. Let's see if we need some more correction. So the incisors, they was a little bit outwards, so we put them more inwards. Overcorrect the rotations, overcorrect everything we want to. Okay. I tried to make this setup as much realistic as I could. No bodily movements, just tipping combined with rotations. And let's do the final thing. I'm quite skeptical about the rotations of the central incisors. I think they're not going to be complete with just aligners. So, so that we need to think about it and prescribe some buttons and elastics between the teeth to fix these rotations. There are a few options. I'll use the one I like the best. 4 buttons, 2 on the second premolars and 2 on the incisors. Well, let's put the attachments. and then see how many liners do we need to produce to make this case done. So for the distalization, I used the tipping movements, so that I'll use these kind of attachments, these beveled spherical ones. Thickness should be 1 millimeter. And let's copy paste it to the rest of the teeth we distalized. I'm not sure we need the attachments on the molars. They have the shape which will give us a lot of retention. I will put the attachments, I'll put the virtual attachments, but I'll tell the doctors not to bond these attachments if when he tries on the liners and the patient's mouth, and if he notices that retention is good, if the liner fits tight, we don't need to bond these attachments. We just bond them to the premolars, to the canines, because their anatomy is different. They don't have that big shape as these molars. But in case if the liners fit loose, the doctor can bond these attachments to increase the retainer and increase the anchorage. Well, for the incisors, I would not place any attachments. I think we'll need an attachment here as well. I'll make it bigger. For the canines, we need to check the direction of rotations. So it's rotation in the mesial direction. We need to put it controversial to rotate it this direction, or to replace it with the triangular one, which I personally like more. I put it more in the center of the crown in this case. Yep. Let's make it a bit smaller. I think 0.8 should be fine. And let's add some torque, -5 torque. To get a stronger retention between the liner and the teeth. And for the lower arch, I would use some attachments for the stronger retention, so we don't distalize here much, we just make some small tipping. We're fine with this kind of attachments. For the canines, we rotate for 1 degree, so it doesn't make any sense to put the attachments on the lower canines. Just 1 and 3 degrees, it doesn't make any sense. To make an intrusion for all the incisors, so that we need at least 4 attachments to resist the forces occurring with the intrusion. So we need to set at least 4 retentive attachments to the premolars. Well done. Let's intrude a little bit. I forgot it's the layer with the buttons elastic. Okay. Now we set the attachments for all the layers. And for the final layer, the layer 6 and the lower arch, we'll add marks for our lab at the areas where we wanted to bond the buttons. So the chains are gonna be this way. Or even almost 360 degrees. So we start we start. Oh, I forgot the initial position. Yep. We start here and do it like this, 360 degrees this way. And these rotations will be complete in a few weeks. By using this technique. I'm a huge fan of it. Well, let's see how many liners do we need to produce to let this case go. I think it should be around 35, 40 sets of trays. Maybe less. Let's see. Let's make 7 for the layer 1. 4 for layer 2. 3. Yep. No, 6 is too many. Let's make 4. 4. And just 1, because we use the auxiliary techniques. Oh, just 33 liners. I thought it's gonna be much more. But for the lower arch, I think it's gonna be more than 23. Let's see. 2, 3. Let that be 3, 3, 3, 3, and 8. Wow, it's a short case. I always try to make the even quantity of liners for both jaws. It's just more convenient for me and for the patient. So I'll add some, maybe I'll add some more trays for the lower jaw. Let's see. It's unnecessary. I just like the symmetry. Oh, Maestro and my recording software crashed. So fortunately all the progress was saved. Now let's see the animation. So let's make sure if we don't have any issues here. We get some expansion at the first layers. We get some space for the alignment of the lower incisors, and then rotate and retract them. Let's see how it goes on the upper jaw. It's a step-by-step distalization, moving not more than 2 teeth at the same time. I mean to the distal direction, of course. To have the anchorage 100% of the time. I would add some negative attachments. This is the last thing I want to do. To help the rotations of the lower central incisors. Damn. I don't know why, but it crushes. Let's try one more time. I like to use negative attachments, especially for increasing the chance of the rotations. When I rotate for more than 15 to 20 degrees, I always add those negative attachments. For the teeth, I rotate for a big degree. Well, I'll put them for the layer 1. Let's make them quite small, so we don't get some excess tension here. And the fit of the liner will be tight enough. So once we start to move the teeth to the lingual direction, we put the attachments to the buccal side. Yep, I like this much better. And I would always add some negative attachment here as well. And now I like the setup even more. And let's upload it to the cloud and show to our customer. Maestro asks me to recalculate the quantity of the liners for the lower jaw, because it can be increased after the changes I've done. Yep. Let's make 5. I hate this. So 24 for the lower jaw and 25 for the upper jaw. Let's upload to the cloud.